Thank you, Dr. Drouin. I'm very happy to be here with Dr. Drouin, as well as Ms. Roy from the Montreal Police Service. Today, I wish to give you some new information, but also come back to certain elements that have been announced in the past few days. So first of all, yesterday, everybody heard the news concerning the big sports and cultural events that are cancelled until the 2nd of July. You will understand that this was a very difficult decision to make, but it was necessary. And this decision was taken in collaboration, of course, with our different partners who wished, on the one hand, of course, would have wished to be able to hold these events, but there was a wish on their own end as well that it be more predictable. So predictability is very important for events such as these. We're thinking, of course, everything having to do with contracts and operations and human resources. So these, the 2nd July, it's for big events where there's a requiring for certificates at the City of Montreal. For everything else, and I said it this morning during the executive committee, but I wish to say it, if you think, for example, about day camps, gatherings in parks, terraces or bars, that's not what we're talking about right now. For everything that I just said, we go along with the Government of Quebec guideline, which is the 4th of May, and after that we'll see. It really will be a national guideline. Now, as far as the long weekend coming up, I'd like to get back to certain elements, certain operations that were set up to make sure, on the one hand, to respect social distancing and also to be able to take advantage of a little bit of fresh air, especially with the beautiful weather that is starting to be with us. First of all, police presence has been reinforced in the large parks and local parks as well. And of course, I wish to thank all Montrealers who are respecting the rules, and I would like to repeat that it is a vast majority. Unfortunately, we know that there are recalcitrants, but we're not creating awareness anymore. We really are going directly to action when necessary. So the SPVM has been handing out tickets, but I will let, of course, Madame Roy talk to us about the state of that situation. We also had to proceed to the closure of the parking lots of the Mont-Royal Park since there were too many people. Amongst that, people coming from the outside of Montreal. So the message that I'm sending out today is that the parks, yes, go to them, but if they're parks close to you, so don't leave the other end of the city or even from another city to come to one park in Montreal or elsewhere. Stay close to your home. We also had to close Notre Dame Island because of so many people going to that place. And since Notre Dame Island is not a park that is close to anybody, well, we acted consequently. I also wish to say that earlier this week, we decided to make the Homestead Road accessible only to people on foot. So cyclists that had the habit of going there, we now invite you to use the Camillien-Houne Road. Homestead will only be accessible for walkers, and that once again to encourage and ease social distancing, which, generally speaking, is respected. And finally, I wanted to talk to you about the situation of the cancellation, another very appreciated place by Montrealers. We decided to close the Atwater crossover, which is just in front of the Atwater Market, and to make the Charlevoix Bridge, which is not very far, accessible only to people on foot, to ease the traveling between one side of the shore and the other. So it's not easy to keep everybody at home. Dr. Drouin was talking about the children and youth. They need to move. The parks are often places that are perfect to be able to do so, and that is why we are putting every necessary effort to conserve those green spaces open. But once again, we need the collaboration of the population at large. Respect the 2 meters. Do not gather with anybody in any way. You know, right now in park, the sports centers are closed, the games are closed, as well as everything else. So the rest of the spaces are open. But if you go play soccer, maybe you can, throw the ball 2 meters away, but a soccer game as such, that becomes a gathering. So we have to keep that 2-meter distancing. It's really very important, unless you are the same family, of course, living together. And for the Easter long weekend, we have decided to increase police presence at the entry of Old Montreal and the Old Port, because last week the SPVM showed us that there was an important number of people, and once again, people who are not at all from that area. So I repeat, if this is not your neighborhood, if you don't live in Old Montreal, don't go to Old Montreal. Stay in your neighborhood, please. So there will be more police officers to ensure, to create awareness and inform people, and to minimize the important number of people. I would also like to mention something new today, and that is to say that we have decided to review the setup of the Mont-Royal Avenue between Fulham and du Parc, to broaden the sidewalk, to give more room to people going on foot, to allow them to respect social distancing when they move around, when they have to do something essential. We know that certain neighborhoods of Montreal are very dense, and when I'm talking about density, I'm talking about a lot of people. So the Mont-Royal and the Plateau area is a very dense area, and on Montreal there's many pharmacies, there's grocery stores, and therefore it became very difficult for people who are lining up to be able to go into the stores to not end up in a situation that did not respect social distancing. So in the next few days, there's a sanitary corridor of 2.7 kilometers that will be created on the south side between Esplanade and Papineau streets, and on the parking lot on the north side between Papineau and Fulham. And that choice was made with a number of neighborhood stores that are to be found there. So the total width of the sanitary corridor will be of 4.5 meters on average. And as you understand, there will be, on the one side will be parking lot, and on the other side will be a broadened sidewalk, which will be closed down with fences. We decided to try out this way of doing things, and once again, to respect the recommendations of the Quebec government, and particularly of public health, while allowing people to go and do what they have to do. So I wish to inform you that this decision, we of course prepared ahead of time. It was done together with the borough, but as well of the SDC of the sector, which received this news very favorably, because it was getting a lot of messages from clients, people who were concerned with this forced proximity. So it wasn't a question of willingness. It's just that there's a lot of people on the plateau. And I wish to say that depending on things will take place, we will be evaluating the possibility of doing this kind of thing in other dense areas, but each one will be accommodated one after the other, because this is not an invitation to go shopping or to go walk around on Mont-Royal. I want you to understand that very well. That is not the purpose. It really is to ease for the citizens in the neighborhood to be able to do what they have to do, their essential tasks, more easily. And of course, the police will be there to make sure that they keep an eye on things and allow us to evaluate the success and how things will take place over the next few days. Now, another topic that we've been talking about a lot are the measures taken in buildings, multiplexes, as we call them, as well as in the OMHM buildings. And with the guidelines that were announced by the public health last week, the City of Montreal is acting to support the safety of the buildings of the municipal offices of Montreal. We know that there are a lot of residents of over 70 years of age who, of course, can no longer go around and making sure that the rules are respected in those buildings. So the city is offering human resources and come and support, and we really are working in collaboration with the OMHM to identify those needs and to help out. I want to say as well that since then there's been awareness raising in all of these buildings, the places where there's at least 10 apartments and more, to really ensure that there is respect of the guidelines, that everything is clean, and to, of course, put up signs to explain the guidelines having to do with COVID. And to end with, I will go along with what Dr. Drouin was saying earlier on. I think that we must, well, first of all, we have to be proud of the fact that despite the fact that we have reached the maximum of community contamination, the number of hospitalized people and the people who have died, and of course I don't want to minimize anybody who died and anybody who has lost a loved one, despite this, things are going well. And why is that? Because Montrealers are following the rules. So I want to congratulate us. I want to say bravo. This being said, this is not the time to stop and to slacken. We have to keep our spirits up, but also we have to continue being very vigilant, and we have to continue respecting all those rules that are the ones that are allowing us to go forward with strength in this pandemic. And in this period of insecurity, I invite us all to show understanding and solidarity toward all those people around us, our neighbors, people who are perhaps not our neighbors, and to think that everybody's working hard to apply the rules and recommendations that are put forward. Of course, I'm going to name you a few groups that sometimes through social media and the newspapers we have targeted more, and I think that we have to be very careful, or at the very least, we have to tell ourselves that individually and collectively we have to be careful with them. Of course, the elderly. We know that sometimes they're being targeted when they leave their homes, and I think that, people mean well, but don't forget that people who are 70 and over, we want to protect them. They're not necessarily vectors of the virus. We want to protect them. So I think that chatting with them and maybe inviting them, you can invite them to go home, but let's show solidarity. Same thing for families. We said it earlier on. It's not easy for families. It's not easy to keep children busy at home almost 24 hours a day. Well, not 24 hours. I mean, they do sleep, but a good part of the day, it is difficult. So when you see family members in a park, well, listen, let's be understanding toward them. I also wish to say that people who are homeless and vulnerable situations, we must show solidarity towards them. The City of Montreal is working very hard to find ways of supporting those who perhaps don't have the means, and perhaps some of them don't even have communication means. We sometimes forget it, but not everybody has the internet. Not everybody hears news all day. So we at the city and the different interveners, we have to find ways to be able to speak to them and giving them the means to be able to ask questions. And we also have to show, once again, understanding and tell ourselves that everybody's doing what they can right now. And finally, I wish to mention that religious communities, the numerous religious communities are respecting the guidelines in the majority of cases, and I want to say how much it is appreciated. We have people to speak with in each community, and those people are doing remarkable work, important work, to be able to discuss with people who perhaps, don't necessarily watch the news like most of the population does. So, of course, there's Easter weekend coming up. There's going to be other religious holidays in April, so I invite us, regardless of the nationality or the religion, the language, regardless, I invite us all to take advantage of this moment to remember to what extent Montreal is a city that is resilient, that is strength because of its communities, and to take advantage of this period where we can't party all together. Unfortunately, this year, we have to do it remotely, but to keep that spirit of openness, of collaboration, and of love, honestly. I think that's really what is going to help us get through it all. To end with, I would invite us to, despite the fairly encouraging news, let's not stop. Let's continue showing civility, respecting the guidelines, and I would like to thank everyone for really helping out. And I am convinced that we will all come out of this stronger as a Montreal community. I almost feel, Madame Roy, to just hand you over the mic, and after that I may say a few words in English. If you'll allow me, right off the bat, in the name of the SPVM, I would like to thank the citizens of Montreal who are collaborating with us every day in the setup of the measures that are sometimes very restrictive. I also wish to mention the exceptional work of our police officers in the field who, since the beginning of the crisis, are showing a lot of sensitivity. They adapt quickly to all the different guidelines that come from all the different levels. So, of course, while remaining supportive with the population, but also the regional public health. And also, to go along with what you were saying, in the past few days, if we're thinking just about who we've deployed in the parks and the staff, I can tell you that we have had approaches about 4,000 citizens on the island. And in those approaches, we have fewer than 10% that required the application of measures that are more coercive. So that shows the great collaboration and support of the citizens of Montreal. Of course, as you spoke of over the past few days, we had to adapt ourselves. Of course, the SPVM has to show agility and flexibility when different guidelines are omitted. Lately, we set up a specialized mixed team of 30 police officers with 6 supervisors and 4 detectives added, of course, to the daily work of our patrol officers in the field just to have the governmental decree respected. Also, we have, of course, created corporate services with investigators or cadets just to ensure accrued coverage as far as the parks of the city are concerned, public places and the parks of the island. And here, once again, I would like to allow myself to thank all of our partners at the city who are adjusting themselves quickly and who are responding to the needs when we have questions. Beyond our daily work, for the long weekend, we have extra resources, so we will be adding our section of corporate cyclists, 125 police officers who will be added to those that were already created beforehand to make sure that the decree is respected, of course, and these people will be deployed throughout the weekend. Of course, what I keep in mind from this crisis is that the SPVM has not changed its approach. We are still in a collaborative approach. We're working with public instances, of course, and we work a lot ahead of time with our partners. And I believe that you'll have noticed that in the application of the rules, the SPVM is showing a lot of goodwill with the citizens of Montreal. Of course, this is a situation which is very complex, but I do believe that in collaboration, we see good results, and we're very happy with the results that we've received up until now at the police services. Did you want to say a few words in English?
And then we'll go straight into questions. Okay, so I'm going to go very a lot of things been said in the last few days around, especially around parks, because Montrealers love them so much, and we don't want to close them. So I've already shared many elements, like closing, for example, the parking on the Mont-Royal. I just want to add that for the long weekend, we've decided 2 days ago that now only pedestrians can have access to the Olmsted road on the mountain. If you're a cyclist, you can use the Camillien Hood, of course. As well, we have decided to close the pedestrian. C'est path, hein? Je pense que oui. Merci. J'ai comme eu un petit blanc.
I had a bit of a blank.
prefer the Canal La Chine to access the market, so this is now being closed, but you can always, we also decided to close down, close to cars, the Charlevoix Bridge, so people can actually walk that there while keeping the right distance. Now what we're adding, though there will continue to be presence of the SPVM in parks, because we think it's very important that people follow the recommendation of no gathering and keeping the 2 meters distance if you're not a family. We will add police officers at different entry points in the Old Port and Old Montreal, because last weekend there was a lot of people there, and as well there was people from the city but also people from outside Montreal, and this is where I want to remind everybody that you should be using a park close to home. If you don't live close by the Old Port, well, maybe you should be using another park or walk in your area. I also want to say that for this weekend, we will review the layout of the Mont-Royal Avenue, because it is a very dense borough. There's a lot of people there, and while people are really working hard to keep the right distance, it's hard because there's a lot of convenience stores, essentials stores there, so it's difficult. So we've decided that between Esplanade and Papineau, it will be the south side parking lane that will be closed and transformed into a sidewalk. And the north side parking lane between Papineau and Folhomme will be for pedestrians. So in total, it's about 2.7 kilometers of a safety corridor for people to use. I think it's important to understand that this is not a new place to go for a walk. This is really to accommodate citizens living in that neighborhood to do the essential movements that needs to be done while keeping the right distance. So I'm really asking all people living on the plateau and people from outside, don't go walk there, and people from the plateau, that it's really to do your essential movements. This measure has been decided working, of course, with the borough, but also the merchant association there. So the SPVM will be there to support and make sure that everything is going well. And if we feel like it's a good idea, we will be working with other boroughs where there's a lot of people, where the density is very high, but it will be a case by case. We want to take time to evaluate every situation, because again, the recommendation to stay home until May 4th is essential. We want to respect that, but we also want to make sure that people can do safe trips, essential trips. Just about the different buildings, the big buildings where there's a lot of people living there, especially with the OMHM. We are there to support the OMHM with any kind of support, making sure that common areas are clean. There's been some raising awareness campaign, if I could say, the information being given to people, residents, telling them what are the right way of doing it, or the rules around hygiene and everything. And so, I mean, that takes me to my last part, which is how do we make sure that we stay strong as a big community? And within our big community, there's many communities. And so it is important not to discriminate. We don't want to go in through massive denunciation. We want to keep an open heart, a good spirit. Everybody's making efforts. Whatever it's maybe the homeless population and the most vulnerable, let's have an open mind about them, because they're going through a very difficult time. We're all going through difficult times, but for them it's even harder. So let's keep that in mind. Same thing for the various majority of the majority of religious communities, which we work with very closely in collaboration. And it is important to, we just want to make sure that no one becomes a scapegoat. That's what we want to avoid. And so there's holidays coming up. There's going to be different celebration. It's going to be tough because usually we spend a long holiday together celebrating, and it's not going to be possible this time. So I ask you to continue to follow the recommendation. This is how we will go through this as fast as possible, and I want us to stay very strong as a big community of Montrealers. So thank you.
Merci beaucoup,
We will now start the question period.
Pour les intervenants, on va passer ensuite aux questions reçues. On en a quand même plusieurs.
Bonjour, Dr. Drouin.
Hello, Dr. Drouin. I would like to know, we talked a lot about CHSLDs, the RPAs and residences. You talked about 62 outbreaks, 49 in CHSLDs, if I'm not mistaken, and differences with the RPAs. Are you able to detail in the different CHSLDs what the situation is exactly? I'm thinking about places, for example, like outbreaks that took place in Verdun or Alfred Desrochers. Well, the numbers that I'm giving you are the numbers of CHSLDs and RPAs in which we have at least one case, so it's not all big outbreaks. And perhaps I don't have the exact number here with me, but we still have perhaps about 10, especially CHSLDs where I would say we have more important outbreaks where we sometimes have even more than 10 residents and workers that can be infected. And the approach right now that we are developing with the measures that were announced with the government is with the objective of protecting those that have no cases right now. What we're setting up to make sure that we know that there's, there's no more visitors, but, there's workers, and how to protect these places in order to not be at 70 or 80 in a few days. And on the other hand, also creating measures that were announced as far as the government for CHSLDs, whether it be for the staff or the screening. So in the next few days, we are going to operationalize all of that a lot more in the service organization of services. We're more in support and advisory role, but to see and make sure that, the hot zones be separated from the cold zones, that people are regrouped, and also that health workers are regrouped. Of course, the screening have started as well, so we're going to select a series of measures, the same ones as when there's flu and things like that, so a series of extra measures to try to limit the number of cases in those areas, so that it doesn't get they're not reflected in our hospitalizations right now, because we know that a vast majority of people who have COVID-19 in CHSLDs don't need care to intubation, so we try to maintain them in CHSLDs. We are receiving a lot of messages of all sorts. So there are people who themselves live in different establishments. Even if I've understood your message, we're getting close to the peak, and so we may be able to start seeing the light at the end of the day. There will still be an increase in the deaths, as you mentioned earlier on. Is that to say that CHSLDs are going to be they're going to do badly? Well, no, I don't want to necessarily say that. What we're saying is that populationally speaking, our curve, we're getting to the peak probably in the days coming up, the epidemic curve, and after that, because there's going to be other phases to live together with as a community, it won't be finished, on the 30th of April. We'll probably get to be more in a management of little curves, and these little curves, these are going to be outbreaks in our places of work or places of care. So we have an approach, yes, of maintaining a certain measures of populational measures, but we are intensifying our management approaches as far as the, outbreaks are concerned. And also, it's already our priority, but this is all going to have to maintain itself for another few months still. I have another question from Madame Roy. You mentioned the approaches with 4,000 citizens since Thursday last, okay. And when you're talking about a 10% that required coercion, are we talking here about concretely, tickets? Tickets or, writing offense reports before we're able to give tickets. So concretely, are you the one who compiled them at the SPVM, the number of complaints for gatherings, or is that directed to 911 or 311 or 911 mainly, yes. And how many are there? I couldn't tell you. Of course, we have a very important increase as far as the calls, denunciation calls for gatherings, whether they be inside or outside, but I don't have the exact number for you. But it's a good increase. Can you give an idea of the size? I couldn't just give you a number. It fluctuates in time, and of course, it has to be understood that depending on the temperature, if it's beautiful. There was one day that was very busy on Saturday, but on Sunday it wasn't so busy. So it really are numbers that fluctuate depending on the weather, and of course, depending sometimes on the press conferences of the premier and things like that, So if new measures are announced, people do react strongly.
Madame la mairesse.
Madam Mayor. I wanted to see with you, you talked about the large events and day camps and things like that. So we'll talk about that again in May. What about the Bixies? How to explain and justify the fact that the Bixies are going to start anyway and will be available as of next week? Well, because you have to see the Bixies as a transportation means that may allow people who have essential, that must go place and who don't want to use the bus or metro that we're trying to decrease. So, of course, that decision was taken with public health. We validated everything with those orientations in mind. And I think that in the same way that we don't want people to go and, take their car and drive around just because they're bored, we don't want them also to take a metro just to go around. Well, we don't want people to take the Bixi to just have a cycling, It's with this idea of an essential displacement, whether it be on foot or by bike or metro, you have to do it only for essential purposes. And there's many people who told us, and we have the numbers to support that. These are people who are going to work, whether it be in the health network, whether it be journalists, it can be people anyway. There can be all sorts of those things.
Question du 98.5. Suite à l'annonce d'hier,
following yesterday's announcement, what about sports that could be held in camera by July? Is there a possibility that it be accepted? Well, we're discussing with all of our partners. We're talking with sports as well, sports meetings, but right now the rule is 2 meters, whether it be for a citizen or regardless of their citizen, whether they be a soccer player or a hockey player or anybody else. So I think that 2-meter rule is absolutely important. And I think that it affects all the possibilities, of course, of holding sports events. Many boroughs are getting ready for the spring floods, and so they think that they should have access to individual protective measures like masks. Is that something that is being thought about? Right now, our teams are working with civil security teams to see how the construction work of the dams can be done safely. So the protocols are being written up, and of course, if there is protective measures or material that is necessary, and we'll look at all the working procedures to make sure that they are safe for those people who will be contributing to them. The Premier said that he wanted to increase the number of staff in the CHSLDs to respond to the outbreaks. What is the evaluation of the number of people in CHSLDs in Montreal? I don't have the numbers because that are really the organization of services that we'll be looking at. These are measures that we are expecting and that we will operationalize. As I was saying, for us right now, where we can have gains in terms of information is within the management of those outbreaks to protect places that don't have cases as well as to intensify our efforts. And it's not so much, yes, adding, staff, but also separating the professionals that are in hot zones and separate them from those in zones where there is no case of COVID, and to, reduce the fact that some professionals work in different places in order to protect patients and, put a stop to transmission. I would like to know in which way the police officers are going to make sure that citizens don't get together during Easter. Are they going to see the number of cars or wait for denunciations? Well, of course, we will not go and just knock on people's doors randomly. As we repeat since the beginning, we need the collaboration of citizens. So when there is a gathering, we invite citizens to contact us. And the 400 tickets, were they tickets or offense reports? I talked about 4,000 people that we approach, and fewer than 10%. And there is a part where it is, tickets, and other were offense reports before we were able to give tickets. Some people don't have the means to hire professional movers. Are we going to allow the friends of those people to move? That's a very good question. Of course, moving becomes an essential service in the context where people don't have the choice. We have a lot of questions, for example, on visits at home in a context where we know that certain people don't have the choice but to go find an apartment. Of course, we're asking people to do it virtually if it's at all possible. Adding group visits, of course, etc., all the hygiene measures. And for movers, of course, professional movers have guidelines, but the guidelines that we develop to protect the people could be applicable to a few people that could come and help in an exceptional context where somebody cannot hire a professional mover. Is this the same thing in case of floods? Are people allowed to help one another out with, during the floods? Well, that's a good question. We will emit general recommendations in the way of working to allow for the respect of the 2 meters.
Merci. In English.
Thank you. English.
What kinds of relief can you give cultural venues if social distancing remains in effect for the long term, like music venues, theater, for Madame la Mairesse?
So like we announced yesterday, all the big events will be canceled until July 2nd. All the big events that have a contract with the City of Montreal. So, and in the longer term, we definitely want to support the different venues, the different cultural organization. It will be a team effort also working with Quebec, finding ways to support those institutions and even those artists. So the City of Montreal wants to honor all the contracts and all the work that we're supposed to do with the different cultural events and everything else. But of course, it will be. We're still looking at how that everything will be. How we can support financially those organizations.
Thank you. For the SPVM, maybe the City of Ottawa says it will fine people $365 if they throw medical masks or gloves on the ground. Is Montreal looking at doing something similar with bylaw?
I'll answer in French if you allow me. In fact, in numerous boroughs, there are rulings that already exist concerning, the throwing away of garbage. You cannot throw, a coffee cup through the window and not get a fine. So it is the position for the time being for the SPVM.
For Dr. Drouin, the City of Westmount is asking all residents and visitors walking or running on pedestrian walkway to move in the same direction depending on which side of the street they use. Should Montreal at large ask people to do this to encourage physical distancing?
At this time, we see that where we have problems of keeping distanciation, the 2 meters, we have put some solutions that are for arteries like Mont-Royal. But I don't think it's, at this time, we don't see that it is necessary to really put this in every side, in every street. But mainly we'll check street by street where there is a problem, keeping the 2 meters, to respect the 2 meters, to see if we have to add specific indications.
Thank you. From the Gazette, could you please spell out the rules and guidelines for Easter and Passover? Can family members who do not live together celebrate these holidays together, or only people who live under one roof?
It is only, people should celebrate Easter, only families that live under the same roof. We should not visit other family members or friends. What I encourage is that during this festivities, you call people or family members or even neighbors who are alone to see if they're in needs, or if they just to have a chat, because we know people are isolated. But please respect, there is no gathering. It is the same thing as we've been doing for a couple of weeks. Only the family members living on the same roof should gather to celebrate Easter.
J'ai une question d'un autre journaliste de Gazette.
A question from another journalist who wrote in French. How can you be sure that the peak of the pandemic will take place in 2 or 3 days in Montreal? This is modeling. It's done using, the beginning of the curve, the setup of the distancing measures. So we know that there are some that were started on the 14th and others on the 24th with a lockdown. So we know that these distancing measures allow us to influence certain parameters. So what we called, RO articles, which is the number of people that each case can infect. So we know that we decreased it thanks to these measures. And this is also modeling. So we have these factors, and we look at the number of admissions, the number of hospitalizations, the progression, and it is often over periods of 3 days. Because we know that Montreal was the epicenter, so the progression is done more progressively. So we were going to get to a peak of hospitalization more around next week, and we know that our hospitalizations reflect something that happens about 7 or 10 days before. So the peak should be during these days. But these are models, these are predictions, nothing is perfect. It might, not be exactly that, but when we look at the model that was presented by the provincial government, that gets with a peak that is closer to around the 15th or 18th, well, we know that Montreal started its progression much earlier. So we expected to have a 1 week difference with the rest of the province, at least, to get to the summit. I received another question in French for the mayor. Since there is a reduction in car traffic, why not close down streets entirely, like Montreal Street, for example? Well, look, I think that we showed today that we are setting up a first model of a street that is adapted to the needs of distancing. So I think that it's important to keep in mind that we want to keep the rules put forward by public health, so that 2 meters, in the case of Montreal, taking into account density, that there's a lot of people in that area, people were having a really hard time keeping the 2 meters. So we'll do it for Montreal. We're also looking at other places of the city, but we really are going where we want to do it case by case. I think that you have to remember that the request is to stay at home. So we encourage people, but we really have to remain at home. So we are there to accommodate and find solutions that respect the recommendations and that at the same time will allow to get through that we go through this crisis as quickly as possible. So in a period such as this, everybody has an opinion of how to do things, but I would also like to mention that every time that there's an intervention in the public domain, it requires physical. And even for the City of Montreal right now, we're working with a reduced team, and these are people who for services that we call essential, So there's also that notion of the organization. Although everything looks very simple, it does require an approach that is coherent and safe for, people moving around within the city, and also to make sure that all the emergency vehicles, whether it be police officers or paramedics or others, can circulate quickly and efficiently, especially in a period of pandemic, where there's a question of health that are totally primordial. Thank you.